Hi, Matt from Glaucoma Pirates here. Wishing you all a happy new year. Just thought I'd give you a quick update as I had my next appointment with my eye doctor yesterday, which was the 9th of January. Obviously, I was given 5 weeks off appointments whilst getting through Christmas and waiting for my eye to sort of do a bit more healing and see where we go from there. Overall, it was a good visit. The eye is doing okay. It's still looking quite messy. In fact, the word the doctor used was, "Oh, it's still quite ugly, isn't it?" Which was nice, very flattering about your eye. So yeah, they took another 4 of the surface stitches out yesterday. Medication-wise, I've been told to carry on the same, so still doing the dexamethasone or Dexa-free every 4 times a day, and then other than that, just the moisturising drops, the Fiolo's Duo, as and when required, which I use quite a lot during the day. My vision is still really blurred. It hasn't really improved since the surgery, so she seems to think that's mainly probably the cataract, which has progressed and getting worse. So I think the next thing that she wants to do is sort the cataract out, probably before removing the deep shoe stitch and making the valve work properly. But she can't do it at the moment because she said the eye is just not healed enough. It's still a bit of a mess. So I've just got to wait for the body to do what the body does and for the eye to heal. And it may be, it may be a few months before it's ready to have the cataract done. So I'm just in her hands with that. My next appointment is in 6 weeks' time. So again, the longest I've been between appointments so far. I've gone from 5 weeks to 6 weeks. So that's quite exciting. I haven't got to go to see her for 6 weeks. But that's the update with the glaucoma, really. Not a lot to tell you in that respect. But I did want to also just explain something else that is a theory at the moment. But as you know from looking at all my other videos, I've had a lot of symptoms with things like foggy headedness, sort of. I feel like I'm slower since having glaucoma, and like my brain's like a little bit behind. Sometimes I get extreme tiredness and a lot of headaches, especially focused on the sort of left-hand side. And for a long time, it's been, obviously, hopefully you've seen the videos about mental health as well, and about anxiety and depression. For the last sort of 2 or 3 years, I've been struggling to understand what's going on, really, and not really 100% sure whether the glaucoma is causing the symptoms, or whether some of the symptoms are caused by anxiety or depression, or some of the symptoms are caused by those stroke-like migraines that I had just before I was diagnosed with glaucoma. So I've had a little bit more insight. I decided to go and see the doctors as a bit of a New Year's resolution, try and get to the bottom of why I just feel so tired all the time, and why I'm having these other symptoms, permanently. They don't seem to be going away no matter what I do. And I managed to see a really good GP, just by pot luck. I think it was my regular practice, but just a different GP, and she really took the time to go through all my notes, look at all my records, look at everything that's been going on with me, and sort of tried to join the dots, and did a bit of a Doc Martin on me, really. A 10-minute appointment ended up being a sort of 45-minute appointment, and she really dug down deep and did a lot of like asking questions and things like that. So anyway, to cut a long story short, she is 99% convinced that, despite my belief that, as you know from previous videos, that I had this rugby injury when I was 12 and did the white matter, and trying to connect, thinking that that's probably connected with why the glaucoma's on my left eye, and the other symptoms that I'm having, and thinking about all that, she's convinced that it's not that at all. The rugby injury white matter is just, you know, by the by. And she thinks that when I had my stroke-like migraines, and especially the final one, she actually gave me the name of the type of migraine that they were. They were hemiplegic migraines, which are basically migraines that mimic a stroke. I lost some sensation, and I was falling to my left. On the last one I had severe vertigo. I was in hospital for pretty much a day and had all the brain scans and everything. And at the time, they just said, yeah, it's this type of migraine. But what this doctor thinks is that when I had that migraine, I've actually been left with a, again, looking at the notes she gave me, a traumatic brain insult, which apparently is quite is rare, which is typical with me. And she thinks that all these symptoms are possibly, I suppose, a form of brain damage from that migraine that I had. She had like a checklist, and pretty much it was everything that was, you know, that I've been suffering with, you know, even the dizziness and the nausea and all this sort of stuff. And even she says the anxiety and depression is a symptom of this condition as well. She said that it can sometimes, when you have one of these type of migraines, it's a bit like a concussion. So you can have these symptoms and they can last a few days, they can last a few weeks, they can last, you know, a year. She says, but in some instances they just, it's just like a permanent thing. So yeah, so that's what's been happening. She's referred me now back to the neurologist that saw me when I had the migraine, which was almost 3 years ago now, I think. So I'm waiting for that appointment to go back and have this properly diagnosed, rather than being a GP's sort of expected theory. So I'll keep you updated with that, but because I've covered a lot of those symptoms and wasn't sure what they were caused by, and now it seems we may have an answer, which is good, because even if it's bad news and I'm going to feel like this permanently, I have these symptoms permanently, at least I know what's causing them, because there's nothing worse than just not knowing what's going on, and you know, that induces its own anxiety and fears, as you can understand. So yeah, so I had a very interesting last week, really. The glaucoma side of it is sort of the best bit, really, and least of my problems at the moment, I think. There is the possibility, she said, that, you know, speak to the neurologist. She told me to speak to the neurologist about it, but there is a possibility that that migraine actually is what triggered the glaucoma in my eye, and the damage to my brain, I suppose, and the blood vessels around my brain could have be what actually started the glaucoma in the first place. So that would be interesting to find out, and obviously probably interesting to you guys as well. So yeah, I haven't got all the answers yet. I don't know for sure if this is, you know, if this is just another you know, theory that will turn out not to be the case. Part of me sort of hopes it's not, and that there is a solution to my problems, but part of me is like, do you know what, at least I'd know, and that would be good if it's something that can be diagnosed, and that, you know, at least I know what's going to happen moving forward and everything. So no, all good. Thanks for watching. Sorry that was a bit longer than I expected, but I wanted to cover that as well. Probably that's it for the videos now, until for another 6 weeks, until after my next appointment with the glaucoma specialist, unless I have anything dramatic to keep you up to date with the other stuff if my appointment comes through. But I'm guessing my neurologist appointment will be months away with the NHS. So anyway, thanks for watching the video, and I'll see you next time. Don't forget to subscribe. Thank you very much. Bye bye. See ya.